or go off in a car driving anywhere in the middle of the night and have no memory of the fact that this has occurred? Would you rather do that or take a natural supplement that just enhances calming, soothing neurotransmitters of the brain and has been shown, like melatonin is one of those, to be anti-cancer, increase longevity, and have a host of other benefits? You just kind of have to make those decisions for yourself. I just can't even believe what's going on. And can you believe the side effects?
America's become a bunch of drug addicts. That's what it is.
It's unbelievable.
It's incredible. Just incredible.
The Harvard School of Public Health researchers examined the association between vitamin C intake and the risk of coronary heart disease, called CHD, in more than 85,000 women who participated in the Nurses' Health Study. Is that a small study on my comment here? Is that a small study?
85,000? That's a good start.
Okay. Vitamin C in 85,000 women. Okay. A not significant weak protection against coronary heart disease was observed in women who received most of their vitamin C from diet alone. But in the use of vitamin C supplements, however, was linked to a significantly lower risk of coronary heart disease. In other words, the women who took the supplements had much less coronary heart disease in the 85,000 women just taking natural
Isn't that amazing?
Just taking vitamin C. So in the Journal of American College of Cardiology, the authors wrote, users of vitamin C supplements appear to be at lower risk for CHD, which is, again, coronary heart disease. Just one nutrient. One nutrient, people. Good grief. And you add that to cardiozyme, and what can you get there? Cardiozyme, dear. You know what cardiozyme is.
I do know cardiozyme.
All those wonderful nutrients that clean out, help to chelate out toxic
You talked
plaque.
about beta amyloid plaque before. Cardiozyme is a major amyloid plaque remover, as well as vascular plaque remover, as well as lowering LDL cholesterol, as well as raising HDL cholesterol. So your overall cholesterol numbers may not change that dramatically because HDL, which generally is too low, is brought up to speed, and LDL, which is generally too high, is taken to task and lowered appropriately.
I forgot the second half of the study. Second half of the thing. Lowering CHD risk is just part of the vitamin C heart health picture. Here are the 3 additional studies, and this is from Health Alert, cited by Dr. Barkley. In a trial that included a large number of male smokers, those with the highest vitamin C intake had a 66% lower risk of developing CHD compared to men with lowest vitamin C intake. That's huge. In a study of healthy middle-aged men, those who had deficient vitamin C levels, listen people, were more than 3 times more likely to have a heart attack compared to men who were not vitamin C deficient. That means less vitamin C, 300% more heart attacks.
This is what Dr. Matthias Rath said years ago. Over and over again.
And an examination of heart attack patients showed that combination of at least 1,200 milligrams of vitamin C and at least 600 milligrams of vitamin E significantly reduced the risk of a second heart attack and other life-threatening complications. That's
much better than statin drugs, folks. Much more effective, much safer to use.
Okay, there you go.
Men with prostate cancer often face one of the 2 treatment scenarios: surgery or hormone-blocking drugs. Dr. Douglas says, I've told you before how prostate cancer surgery is needlessly causing tens of thousands of men each year a lifetime of problems such as impotence and incontinence without removing the cancer. But doctors are starting to learn that the hormone blockers that prevent the production of androgen are no walk in the park either. In fact, that can kill you. A new study of the Journal of the American Medical Association tracked more than 19,000 men with prostate cancer over a period of 6 years. The men were all 66 and older, like many of my readers. Guess what the researchers found? The men who were treated by hormone blockers had a higher rate of death than the men who skipped or delayed treatment entirely. Surprised? I'm not surprised, says the doctor. These drugs have been linked to heart disease and diabetes, not to mention impotence. Even the American Cancer Society's chief medical officer, reacting to the study, said he hoped doctors would be more cautious about giving these drugs to older prostate cancer patients. But of course, some doctors just can't help themselves. They can't